Special features of the MSci Nursing programme in relation to clinical practice are the fact that students have some choice and flexibility over their clinical experiences. Students have quite a structured placement circuit in years 1 and 2 of the programme, and they go to a range of different settings. That could be acute hospitals, they go out into the community to community nursing teams and also community hospitals. They have some primary care experience and they also have some mental health setting experience. What that means is that students are really well equipped at the end of year 2 to make a decision about whether they'd like to follow the dual registration pathway or the single registration pathway. It also means that they have a better understanding of what their career aspirations might be. And so it means when it gets to years 3 and 4, they then have the option to make some choices about what modules they'd like to do, but also whereabouts they'd like to go in clinical practice, what areas they're particularly interested in, where they think they might like to work. And I can tailor their choices towards those opportunities.
Our MSci Nursing program is special because it gives students the opportunity to have a dual registration, therefore will have more opportunities and be able to embrace better opportunities as professionals, as registered nurses. And also, they learn very early in their program how important it is to look after someone's mental health as well as physical health.
The MSci Nursing programme allows students to have the opportunity to train both as a registered mental health nurse and a registered adult nurse simultaneously, and from a mental health provider point of view. That's really exciting because it means that we have the potential to bring nurses in who have both skill sets that they're developing simultaneously.
I work with a range of health and social care providers to set up placements for students.
So Devon Partnership NHS Trust has established a good working relationship with Exeter Academy of Nursing. This nursing programme is really important for 2 reasons. One, because it picks up both the importance of physical and mental health care, but also it gives people an opportunity to explore various components of nursing practice. The importance of having the dual registration not only gives people the opportunity to think about their skill set and where they might best use that skill set, but it also gives a lot more opportunity for the wider workforce in terms of the availability of jobs and where that might be.
I think it's a good time to have a dual registration in mental health and adult nursing because we're developing our understanding all the time around the impact of physical health on mental health and vice versa. Having clinicians who can seamlessly move between those particular sets of needs, who can use them interchangeably, and most importantly, I think, who don't necessarily differentiate is so important.
Another feature is the small cohort size. That's a really big advantage of our programme because it means that not only do I have the flexibility to be able to know students and know what their preferences and aspirations are, but I can also ensure that students are getting a really high level of support. We have a really good staff-student ratio, and what that means is that students are very well supported when they're out in the clinical practice learning environment so that they feel connected to the academic learning environment and to their peers and to us as the faculty, even when they're not physically on campus with us. The clinical practice structure means that students have a meaningful experience in both physical health settings and mental health care settings, and it means that they can integrate those in a really meaningful way.